Today, we will be going over how the medical abortion works. First, we will go over what's going to happen today, what you can expect tomorrow, the coming weeks after an abortion, and follow-ups. Once the video is finished, we will be happy to answer any questions you have or review anything you would like. You will also be able to speak with the doctor once the video is over and they come in to give you your first pill. A medical abortion consists of taking certain medications to end a pregnancy. At our clinic, we use a set of 2 medications for a medical abortion. You will be taking mifepristone and misoprostol. Today, one of our physicians will be giving you mifepristone, the name brand being Mifeprex. Mifepristone helps to block the pregnancy hormone called progesterone, which stops your pregnancy from developing. Today, you should not feel any symptoms or side effects with Mifeprex. On rare occasions, some people will experience spotty bleeding, which is normal. However, if you have heavy, continuous bleeding, please give us a call so we can give you further instructions. It is also important to note that if you throw up within 30 minutes of taking Mifeprex, we need you to call our office so you may come back and purchase another pill to ensure that the medical abortion will work. If you throw up well over 30 minutes, there is no need for concern. Once 24 hours have passed from the moment you take Mifeprex, that is when you can start taking the next set of pills, which are called misoprostol. The maximum time you can wait to take misoprostol after taking Mifeprex is 48 hours. Before you start taking your misoprostol pills, we recommend eating a light meal 30 minutes before you start taking them. You should avoid anything that has dairy, has a lot of grease, and is spicy. You should also take ibuprofen 15 minutes before you start taking misoprostol to help mitigate your cramps. Once you start to feel heavier cramping during this process, take acetaminophen, which is also known as Tylenol. We recommend alternating your medication so you're consistently taking something to alleviate the cramps. After eating your light meal and taking ibuprofen, you'll grab your bottle that contains your misoprostol. There will be 4 tablets for you to take. You are going to place 2 pills on each side of your lower cheek and gums, and you'll let the pills dissolve for an hour. Once the hour is done, grab some water and swallow any remaining medication. If you throw up your misoprostol tablets under 30 minutes, please call our office so we may give you further instructions. If you throw up and the pills have been sitting in your gums for over 30 minutes, there is no need for concern. Misoprostol helps to soften and open up the cervix. These pills also cause the uterus to contract. Bleeding and cramping can begin any time from the moment you start letting misoprostol dissolve in your cheeks, so feel free to wear a pad right away. If you have no bleeding or cramping after taking misoprostol, that is not normal, and we need you to give our office a call as soon as possible. You can expect to pass the pregnancy within 3 to 24 hours after taking the misoprostol tablets, but it should not last more than 24 hours. Bleeding during your abortion can be quite a lot. You can expect to pass pregnancy tissue, blood clots, and experience heavy cramping. Some of the side effects of misoprostol can include nausea, diarrhea, tiredness, chills, and a mild fever. These side effects should not last more than 24 hours. These side effects can also be managed by taking ibuprofen, acetaminophen, using heating pads, and massaging your uterus. Keep in mind, medication abortions are about 98% effective during the first 10 weeks of pregnancy, which means 2 out of 100 people may experience a failed medical abortion. It is also important to know that misoprostol can cause congenital malformations if the pregnancy were to continue. After an abortion, you can expect to have on and off bleeding that could last anywhere from 6 to 12 weeks. You may still experience cramps after an abortion, which can last up to 2 to 3 weeks. Take Tylenol and ibuprofen to help with the cramping and avoid any aspirin, since it has blood thinning properties that can increase your bleeding. Your menstrual cycle, which is also known as your period, can take anywhere from 3 to 12 weeks to get back to normal. Pregnancy symptoms usually go away within 48 hours. It is also important to understand that your body is extremely fertile after having an abortion, and you can become pregnant almost immediately. If you are not wanting to get pregnant anytime soon, we recommend using a form of contraception. There are no physical restrictions after an abortion, and you may return to normal activities the day after your abortion if you're feeling up to it, or unless you receive different instructions from the provider. The only restrictions following your abortion is having nothing inside the vagina for 1 week. This includes, but is not limited to, tampons, Diva cups, douching, sex toys, sprays, or deodorants. If any of the following occur, we suggest going to the ER right away. If you are having heavy bleeding after the abortion, meaning saturating 2 thick pads every hour for 2 hours, followed by feeling faint. If you are having unbearable cramping that makes you feel faint, you're unable to walk or do regular activities and does not improve with medication. If you have a fever of 100.4 or higher that is not going away even after you've taken medication such as Tylenol. You will be sent home with 2 pregnancy tests. Once 2 weeks have passed from you taking misoprostol, you will need to take your first pregnancy test. If your first pregnancy test comes back negative, the pills have worked and you will not be required to come in for an in-clinic follow-up. If the first pregnancy test comes back positive, you will then wait another 2 weeks and take the second pregnancy test. Many times patients will test positive at 2 weeks due to pregnancy hormones still being present in the body and then test negative at the 4-week mark. However, if you still test positive at 4 weeks, please call our office to set up a follow-up appointment. You will also receive email reminders to take your pregnancy tests at the 2 and 4-week marks. The in-clinic follow-up appointment will consist of us conducting a pregnancy test and an ultrasound. If we determine that the medical abortion has not worked, we will then discuss options following a failed medical abortion. Thank you for watching this video brought to you by CARE, Clinics for Abortion and Reproductive Excellence.